I offered to bring my son and a few of his friends that have been affected by the exclusion down. Only my son could come because his other 3 or 4 friends are all busy working today. One's working at the mall, another one's at a grocery store, and the other one's working in a restaurant. They've all been excluded from going to school, but they're out there in society handling food, doing whatever, interacting with people, and they're not coming down with the mumps, they're not spreading the mumps, but they can't go to school. And I think this is just kind of ironic, and so I just wanted to share it with you. Even though I was offering to take them all out to Mod Pizza afterwards, they're all busy up working and making extra money. So there's not seem to be a problem with their employers or the places in society that they're working. It has to do with the fact that there's a group of people that for some reason the vaccine or their immunity is not working and they're coming down with the mumps.
75% of our cases are within the Marshall Island community members. That's 215 cases in Spokane County out of the 286. These demographics argue that the mumps is not being transmitted at school. Otherwise, wouldn't you see a broader distribution of cases in the non-Marshallese population? In some schools, all cases could simply be mumps working its way through the kids in a household or 2 sibling to sibling over a period of weeks. Exempt children are being excluded until all the vaccinated kids are infected and recover. The exempt students didn't start it, they didn't spread it, and aren't sustaining it. What medical necessity is achieved by excluding them?
I'd like to move into the administrator report. So we have epidemiology.
Yes, Anna Halloran will do that piece for us.
Good afternoon, everyone. There are 2 primary topics that I'll be providing an update on, influenza and mumps, to give you the current numbers. With regards to mumps, thankfully this activity also continues to slow. To date, we've had almost 290 cases that have been confirmed or probable cases reported to us, and approximately 300 additional individuals have been investigated. The state as a whole is nearing 700 cases total. Most are in school-age children, like in our county, and almost 2,000 people have been investigated since the start of the outbreak statewide, so it's been really taxing on public health.
Vaccine myths. Let's go over them all. Vaccines cause autism. What is my job description now? I do behavioral pediatrics. I diagnose, or at least get asked to diagnose, most of the cases of autism in the community, and I manage them. That's my job. I have 3 visits today, new patients. I go to Mass General every January and go over the latest data. There is absolutely nothing in the literature that supports any concept that vaccines cause autism. The only evidence you have is Jenny McCarthy, whose figure, I guess, is her authority. And she said her child was the perfect child. He was our little bird. He flapped and he flapped and he flapped, never bothered anyone. And then he had his MMR and he got autism. Unfortunately, what does a child look like when they're pre-diagnosis at the age of 1? They don't bother anyone because they could care less about anyone else, and they flap. So she gave a perfect clinical description of autism before diagnosis. Yes, we see autism appear around 1 to 1.5 because that's when you are able to see the symptoms develop or be very clinical. But she had a great clinical decision there. The big controversy came from Dr. Wakefield. He was in Britain. He was under the pay of a plaintiff's attorney who was trying to seek money from a vaccine manufacturer. He got $675,000 to testify. He falsified his data. The editor of The Lancet, which is the British medical journal, was fired for accepting his article. Every one of his co-writers on that paper recused themselves and said, hey, we didn't know about this. And the lab that he used falsified the data. He still gets quoted. Yes, sir.
Mr. French.
One of the slides you had there touched on, because that's what I hear all the time, that vaccines are responsible for the sharp increase in autism. In your opinion, what is it if it's not vaccines?
Number 1, there is no sharp increase in the number of kids with autism.
Okay.
First of all, if you take, there are 3 groups that were in autism. There was classic Kanner described autism. He was the guy at Johns Hopkins. Maybe 10% increase, okay? Then there was Asperger's disorder, increased recognition, and that was due to Sheldon on the Big Bang Theory. People learned to recognize Asperger's, so that numbers increased. Although he was cute. I think you had to watch Parenthood. because there you saw the pain and difficulty associated with it. And then there was this grab bag called pervasive developmental disorder, not otherwise specified. These were all under pervasive developmental disorders. This is a grab bag. Any kid that was a little quirky, a little different, got labeled. And that's where this dramatic increase in numbers of autism happened. They fixed the epidemic by what? Truncating it off. DSM-5 eliminated that group. And yeah, you can say there's a 10% increase. But as far as hardcore classic diagnosis of autism, there really hasn't been a substantive. Vaccinated children can shed virus and infect others. Not true. Now, the last concept I want to talk about is herd immunity. No vaccine is 100%, well, some are pretty close, but most vaccines, mumps, 88% effective. So you can have the vaccine and still get mumps. How do we prevent mumps from getting around? We have herd immunity. If you have greater than 90% of the people immune, then you cannot start an epidemic. You need to have vulnerable people around to share it with. So the reason we immunize everyone is to prevent vulnerable people who maybe can't get immunized, little infants or people with immune deficiencies who can't be immunized. We can prevent the epidemic by doing everyone, and that's why we do everyone. We depend on almost all of these on herd immunity to prevent. Once again, you can't treat it. It's a viral infection. It runs its course. Vaccination, 2 dose course, 88%, 1 dose, 78%. You get the first one at 12 to 15 months, second one going into kindergarten.
So I'm still confused as to, with like mumps, how, because I believe, and maybe I'm wrong on this, but I thought that the Spokane area was over 90% immunized. So if our goal is to get 90% immunization, and we have that basically, and 90% of this spread or more is through the vaccinated group, what are we missing here?
Well, sometimes there's questions of whether someone who has stated they're vaccinated, particularly in certain groups.
So in 2013, I wrote an article about this, and actually nothing has changed. It's the same issue. First of all, there is a paper that shows that memory B cells are inadequately produced by the mumps vaccine when you compare it to measles and rubella. And in fact, when you do neutralization tests, there are differences, striking differences. So that may also account for the breakthroughs. People with high titers occasionally will get sick. People with low titers may be protected, which suggests that neutralization titers are not the sole correlate of protection. So the question now is, obviously, what do we do about this? I discussed in the paper was developing a new mumps vaccine. Now, that's a frightening proposal because, what are you, how are you going to do that? I do think that it could be done. I do think at this state of virology in 2017, we probably could develop a new mumps vaccine. Spending millions of dollars to develop such a vaccine is not an attractive option. But it should be thought about because, as you said, this is an attack on vaccine confidence. But anyway, I think there are biological reasons why the vaccine is failing.
Whoa!